what we're trying to do is come to a definite diagnosis and confirmation that we're dealing with stomach cancer, and subsequently we then stage the patient. First, we always do simple blood tests like a full blood count, which can show if there is any signs of low blood level. We also do things like and check your kidney function as well as your liver function, because that will affect how we proceed on with further investigations. And then, of course, if the suspicion is high enough, we would often also do tumor markers. And with stomach cancers, we always do tumor markers called CA or a CA19-9. Following that, we would most oftenly consider doing some kind of imaging or x-rays. Finally, we also want to do an endoscopy in order to confirm that the patient has stomach cancers. And this is the most sensitive way to diagnose stomach cancers. It allows us to see the tumor directly, to know where the tumor is growing, and then, of course, perform biopsies where we take a little sample of the suspected area and we send it off for testing to confirm what it is. The scope also allows us to see where the location is, as I mentioned, and that will allow us to determine if the patient is going for treatment or surgery, how the surgery will be planned. So after we confirm that the patient has cancer, we would often go on to what we say stage the stomach cancer, and that is usually based on a T-N-M categorization. So T usually refers to the local tumor itself and how big it is and how many layers of the stomach wall it has gone through. N refers to the nodes, and there are always nodes around the stomach. And M refers to metastasis, or whether there is spread to other organs that are away from the stomach. So as I mentioned here, the T staging. So depending on how deep and how big the tumor is, the T number will increase, with T1 being a very early stomach cancer and T4 being an advanced cancer that has come out through the wall of the stomach. The end stage is the nodal stage, and here we're looking at the lymph nodes which are found around the stomach, and the end stage will increase if there are more nodes involved, or there are nodes found in a little bit more further areas, like for example in blood vessels which are further away from the stomach. Lastly, the M stage, and this slide is just trying to show how stomach cancer usually spreads, and that's how doctors, in that sense, and how we plan our diagnosis and staging. Because we know that in stomach cancers, the metastasis tend to either involve lymph nodes around the stomach, or it can involve lymph nodes that are far further away, for example, in the neck.